specialize in scoliosis. Scoliosis typically starts in adolescent years when children start puberty. As they grow, they have an idiopathic growth change in their spines causing scoliosis. This can be in the upper spine and the lower spine. Sometimes both areas are affected. When pediatricians or parents notice the change in spinal growth, they are often sent to a spinal orthopedic specialist for monitoring. X-rays are taken to confirm the diagnosis and to assess the Cobb angle, which is the degree of the curve. Typically, if a curve is under 25 degrees, monitoring is continued. Usually every 6 months is the course of action. A curve greater than 25 degrees leads to bracing and therapy. Greater than 45 degrees is surgery with rod placement to limit further progression. Scoliosis exercises are beneficial for all structural curves. Curves greater than 10 degrees have the best results. Exercises are performed in all positions with emphasis on breathing during sitting and standing, as they are primary positions throughout the day. The focus of this program is on maintaining the spinal curve and limiting progression of the curve. With correct use of exercises, scoliosis curves may regress. If you wish to know more on how to stabilize a curve, please contact me at Focus Physical Therapy. Our direct line is 502-509-3136. You can email me at Renee at physicaltherapylouisville.com or visit our website, physicaltherapylouisville.com.